Thank you all very much. I've been asked to introduce myself visually. I'm a white man wearing spectacles and a blue shirt with a bit of curry that I'm trying to hide with a lanyard from lunchtime and a grey jacket. I'm director of the Bering Foundation, and the first thing I'd like to say about our work is that we're a human rights funder. And that, to me, is very important, that it frames why we're doing this work. In terms of what we're going to do in this very brief session, we've only got 20 minutes, so I hope we might be allowed to overrun by a couple of minutes, because I hear there's some questions. So I'm going to introduce a report and describe that very briefly. It's available from today, and we're launching it today with the support of the Museums Association, which we're extremely grateful for, and it's also available hard copy from our office. I'll do that, but much more importantly, I'm really delighted that Clara Shields is going to give us a much more in-depth explanation of the work that they're doing at Tyne and Weir in this exact field. So the Bering Foundation, as an arts funder since 2020, has been making grants to encourage creative activity with people with mental health problems. As always, we choose those words very carefully, and as with everything with mental health, they are contested. But we're using the phrase mental health problems really to indicate some difference between the sorts of things that you've been hearing about already. The Museum Association's been talking a lot about well-being. We think there's a lot of work in museums about well-being. We think there's much less about specifically engaging people with mental health problems in the way that you're just about to hear from Clara, and that's where our work's directed. So it's going further than that preventative therapeutic aspect of all museums being places that are inspiring and calming. So far we've given 130 grants to arts organisations in this field, and there's a number of more publications online which you can find. We chose this field of a new publication. I've got a single visual aid, which is our publication of today. We chose this field because we think there's not only is a lot happening in museums, but a lot has already been written about well-being and health more broadly in museums, but not about people with mental health problems and their relationship to museums. The report very briefly sets out some history about how this work has started and looks at examples from overseas as well as in the UK. Throughout the conference today, I've been thinking that people with mental health problems, of course, an immensely diverse and complex group of people, but there's so many parallels between the themes that have been talked about today already, about hidden histories, about cultural democracy, and this group of people which we feel hasn't been explored properly yet. The report goes on to describe some principles about this work, which you won't be surprised about. A really important one to me is that to be authentic, a museum that's setting out in this work should be thinking about the mental health of their own staff. And again, that goes beyond well-being into proper policies and respect for staff that are experiencing mental health problems and valuing their experience as well. There's a large number of other principles. Obviously, mental health problems, it's a highly intersectional issue where you also want to think about class, about gender, LGBT people, and mental health problems, and of course racial inequity, but many other issues. There's issues of safeguarding participants and of valuing lived experience, and particularly in this field of destigmatizing mental health. They're all things that museums can be thinking about and are thought about in these case studies. There are 15 case studies. 3 of them are specialist museums of mental health in Bristol, in Leeds, and of course the famous Museum of the Mind in London, and 12 non-specialist museums, non-specialist regarding mental health. And you'll see from the case studies many different approaches that are being used. You're about to hear of some of them from Clara, but also the use of traineeships, of working in the community, working on wards, working in the museum itself, and all sorts of creative workshops. But to hear from the real deal, I'll hand you over to Clara and her work in Tyne and Wear.
Thanks, David. So my name's Clara Shield. My pronouns are she, her. I'm a white woman with short brown hair wearing glasses, and I am wearing a black and light pink patterned dress. So I'm an assistant outreach officer or programme lead at Tyne Archives and Museums in the northeast of England, and I belong in the Culture, Health and Communities team, where creativity is at the heart of all of our engagement approaches and work that we do. We have a range of programmes targeted on specific themes, but pertinent to this particular presentation is our work around addiction recovery and mental health. So we have been developing creative practice and producing both physical and digital resources that support our work, using our collections as a starting point for this. And the approach that we have and are undertaking all the time in our work is to work collaboratively with our partners in our local communities. And my work is specifically around mental health, so that's with our health and NHS partners there. We've been working for about 5 years now with Northumbria University's occupational health studies degree, and working alongside their students, or the students working alongside us. It's very collaborative, where they come on placement with us in their 3rd year as part of their studies. So very much in terms of our delivery and the future of where our work can go, it's about working with and alongside the workforce, working with patients with mental health issues. So I'm going to talk a little bit about the current work that I'm doing at a hospital in Newcastle called St Nicholas's Hospital. Now, St Nicholas's Hospital has a variety of wards, and this includes an adult forensic, medium and low secure unit. It has wards providing adult urgent care, acute care and rehabilitation for adults. And for the past year, I've been working across 2 different wards. One was a male-only ward and one is a mixed ward, where I've been delivering a heritage programme of activity. So I'd like to talk a little bit about the Willow View ward, which is a mixed ward. I work there every Tuesday afternoon. I was there just this week. And that is a ward working with patients who have already got a diagnosed mental health problem, and they have reached a crisis point and have needed some acute care. So they have come back onto a ward. Some of the patients are familiar to the staff there, some are new. And they normally spend around 12 weeks on the residential ward, and then they are discharged if they're well enough. Some of them spend longer there. So I work with them on a Tuesday afternoon, where I go into the ward with a variety of different, mostly boxes, handling boxes, but different heritage materials that have been informed by the patients themselves. So we ask what their interests are, and we try and respond as much as we can within our collections to then bring interesting items that they can then be part of the conversation. We also encourage, because we can with this particular ward, for them to come and have a trip to one of our venues. We are a 9-venue service across Tyne and Weir, so we have both galleries and museums. So it's really important for me and for our service itself to encourage these patients to be able to access our services, to come into our museums, with the hope that when they are discharged and they feel and would like to, they may come back independently and autonomously as part of their ongoing recovery. Because museums and galleries aren't going anywhere, where often their health might reach an end point, they can continue that relationship with us. I asked Chloe, who's the activities coordinator on the Willowview ward, if she would just put a few sentences together that I could use today, because we can all stand here as museum professionals and talk about our work and how we can see the impact and how enjoyable it is for us to see a real difference that we can potentially make and use in our collections in innovative and creative ways. But how is that a real thing for the patients? And often on these wards, it's the clinical staff working on these wards day after day that really see any change or impact of the work that we do. So Chloe, thankfully, sent me a really lovely email with lots of quotes, and we've talked a lot today about how words matter, and I'm just going to read Chloe's words. Generally, it's such positive and lovely comments after Clara's been in. We have noticed that patients have talked about sessions a while after they have taken place. Patients look forward to the arranged trips and continue to mention these in conversation, and these become a key focus of their time. Staff have said it feels as though Clara is bringing the community to the comfort of the ward, and this allows them to try something new. It allows the patients to experience new things and learn things they may not have learnt before. Chloe talks and says that she herself has learnt about things about patients, things about them that she's never known if we hadn't done the sessions or the trips. For example, one individual looked at some old comics and commented about his childhood. We did an exercise around Georgian tea tasting, and he told us about how he worked in a tea shop. We never knew this about him before. And when we attended the Lane Art Gallery, we learned that some of our patients have a keen interest in art, and they have favourite artists, and they continue to discuss, and they asked us to print out some of their artwork so that they could put it on the walls in their room. Patients overall appear to enjoy the sessions and seem to enjoy learning something new, particularly the object handling boxes that Clara brings. It's a nice change from some of the regular activities, which may be quite similar across the board at any given hospital. The patients consistently thank us for the session. They like the interactivity, but also sometimes they just like to sit and listen. They enjoy the trips out and look forward to them. And on one of the previous trips, a patient returned to the ward commenting on how much he had enjoyed this trip, and he has continued to discuss this with peers and how it had been for him a really nice day. Chloe says that in her opinion, she has seen a different level of engagement and interest since these sessions started, and they continue to enjoy and look forward to them weekly, as there is always something new to learn. And if she could keep us attached to her ward forever, then that would be ideal. So that's testament really to that kind of collaborative working of both the staff on the ward and what we're able to deliver as a service. And I'm really keen to see how this project can continue, particularly around the future for the patients as they're discharged from the ward, and what we can do as a museum service to support them in their integration back into community services. Thank you.
Very good. The last things I'd like to say are that prior to this work with people with mental health problems, we had a programme for 10 years which was about arts and older people. And a lot of that was about people living with dementia. And it struck me, writing this report, that if I'd written something that was entitled People Living with Dementia at the museum, it would have been 50 times as long. That there are an enormous number of initiatives, thankfully, wonderfully in museums about engaging people with living with dementia. And that's been growing in the last 10, 15 years and is very much welcomed. But it was much, much harder finding examples of direct engagement with people with mental health problems. So perhaps it's a field that requires further development. There's a series of recommendations in the report. We're going to be releasing podcasts quite soon of people like Clara talking about their work that's covered in the report. There's also an article in the Museum Journal. There will be a free conference in London in the spring on this subject at the Dulwich Picture Gallery, and we're starting to think about online guidance as well as encouraging other funders to think about this. Because we had such a short slot, I didn't think we had time for questions, but there are some. Is that right? Yeah. Okay. Good. Then that's wonderful, because that's much more interesting. And did you say there's some online as well?
Yes, someone has just posted a question, but it's disappeared, but I can remember what they asked.
And shall we do them together?
So I think this question was for Clara, and it was, do you have any quotes from the patients on the wards?
Yes.
I'll just add there's lots of quotes from patients in the full report, which you can see today.
I happen to have my my notebook because I always write down everything that happens. One of the patients from one of the visits to our Discovery Museum was a veteran, and he was really interested in our one of our gallery exhibitions called Charge, and we have a brilliant group of volunteers that work there who are also veterans, and he was able to talk to someone who had served just like he had and had his story kind of validated, because no one else on the ward talks about this because it's not part of their experience. And he, when we evaluated his experience there, he said that being able to talk to someone who knew what his experience was the most kind of solidating of his identity, of who he is, which he felt he had lost. So this had been quite a period of time had passed since he'd been in the forces, but meeting someone else who also had served and had that experience was so important to him, and the staff on the ward hadn't realised it was that important and had made such an impact on his life. And just to add what happened after that, because I think this is really unique, is that he was going to be discharged out into the community. So one of the other members of staff got him registered as a veteran and enabled him to find out where the local veteran breakfast clubs, because they happen all over the country, were happening where he was going to be rehoused. And they were able to give him that package of support when he left the ward, to be able to find other like-minded people to have these conversations, which clearly were really important. But no one on the ward, for all the time he'd been there, and he'd been readmitted 3 times onto the ward, realised it was that important to him. So that just shows, what would have happened if he hadn't come, if I hadn't gone onto the ward, if I hadn't taken them to one of our venues, and he hadn't met one of our volunteers at one of our venues who gave him permission to talk about what was important to him. So I know that's kind of gone a little bit off the answer, but a perfect kind of where you've had that impact, and it's been a positive experience for a patient. Thank you. Oh, there's a...
Thanks very much. Have you thought about looking at how this could work with social prescribing, or how it could evolve into a larger system?
Yeah, that's exactly where we're at now. So in terms of our community's work, we are doing a research program at the moment with social prescribing. So we have someone working with us in the team to think about all of our work and what our offer could be in terms of social prescribing. And I really think that this particular piece of work that I'm doing, it lends itself so well to be able to kind of like bring in who is around and who are the partners that need to be having those discussions, to provide that support package and that offer to individuals. So yes, it's watch this space, because we're developing that on our website for social prescribing.
Thank you. No, it's great to have bearing support for this work. And it was great, David, to hear you say that talk about the intersections with class and race and so on. I wonder, there's often a narrative around mental health that it's the responsibility of the individual and that people need to be on a process of getting better. But there's also, as you mentioned, lots of societal reasons for people's mental health problems. And I wonder how museums can kind of get involved in helping people platform those societal structural issues, and not perpetuating that sense of people just need to work on themselves.
Thank you, Damon. It's a great question. And there's a number of exhibitions that are discussed in the report. And what strikes me in those exhibitions is that they're saying very much what you're saying. Mental health is complex, and there are many, many different factors to it. But there are very, very important societal factors. And in the exhibitions that I've seen, those are discussed. And I think museums are obviously exactly the right places for those to be discussed. Great, thank you all very much. It sounds as if we're drawing to a conclusion, yeah. Thank you, thank you.